Mhm.
So what sort of exercise should we do to increase or at least maintain our bone mass?
So the catch cry is weight bearing or load bearing exercises. So again, I guess my brain is very small. If you think of your spine as a straight up and down unit, you want things that are going to come down and provide pressure from that top end and squash downwards, and that'll hopefully essentially stimulate the bones to sort of go, oh, I'm being used in this way. I need to get stronger in this way, and so they'll hopefully increase their
Yeah.
bone mineral density.
So we need some sort of purposeful stomping involved. Unfortunately, walking doesn't cut it. It's not enough impact involved. So
Mhm.
you should be doing exercises that involve purposeful impacts, at least 50 of them. Every day, ideally, but the sort of things that are recommended are stomping, jumping, hopping, dancing, tennis, basketball, these sorts of things. But as well as having a stomping element, we're really looking for you to have a changing direction element,
Mhm.
to stimulate the bone, not just to get strong for that particular movement. The bone will tend to get strong for whatever movement it is that you're doing. And if you're only doing the
Yeah.
one movement, then it'll only get strong for that. Yeah.
Mm. Yeah. And it's probably worth mentioning some exercises that aren't good in that context only because I'm a keen cyclist and I think you're a pretty keen cyclist as well. Those things aren't good because they don't have that compression side of things.
No.
Yeah.
I think a lot of cyclists sadly have quite low um, bone mineral density, which we'll talk more about next week. But yes, my endocrinologist is fond of reminding me that cycling might be my favourite type of cardiovascular exercise, but I'm not helping my bones whatsoever and I need to be doing more things.
Mm.
So cycling sadly doesn't great, not any good for bone health. Walking isn't enough of an impact to make any difference, and swimming also is not weight bearing exercise and certainly would not be recommended therapeutically. With the aim of increasing your bone health,
So it's great
cardiovascular.
if you do those things, but we probably need to add some more
Yeah,
load bearing
absolutely.
exercise to
Yeah,
maintain bone health.
yeah. So we've
Yeah.
got our weight bearing, stomping, moving around in different directions, exercise, lots of repeats. But we also want you to do some resistance or strength training, which should be
Hmm.
moderate to high intensity and should involve moving the muscle groups that attach to the hip and the spine.
Yeah.
That's at least twice a week, I think, is a current recommendation
Yeah, I
for
think
that.
so.
Yeah.
Yep, that's right.
So the other type of exercise that we'd love you to be doing is to do an exercise that increase your balance, that challenge your balance, because the
Hmm.
better balanced you are, the less likely you are to fall.
Yeah, absolutely. And I think again, social media is flooded with, quote unquote mobility exercises and so on and so forth. They're great. Like that's the plan. We want to make sure that we are mobile and agile and have excellent balance so that we're not, on our backsides when we're, trying to tie our shoelaces or do something else like that.
Yep. But it has to be high challenge, and high challenge is very individual, but it's got to be challenging for you. So if you're going to Tai Chi or Pilates or body balance and you're finding that stuff has now become easy for you, then you're not helping yourself. You need to step it up to the next level and make it harder. So you should wobble, you should almost fall over when you're doing your balance stuff, because if it's completely easy within your easy zone, you're not challenging yourself and you're not maintaining or improving.
No, that's right. Yep.
It needs to be challenged basically all levels of our exercise to help our bones.
Excellent. Anything else to add to today's bone health chat, Dr. Anne?
Well, I think we've covered all of the things: diet, exercise, and lifestyle, but the devil was in the detail, and hopefully we've covered that today. Any people have any questions? We're happy to hear from you.